Now we can start with the Q&A session to our speaker. So I think they have a few questions in the chat box. So Dr. Shen, so I think you mentioned about the complication that we are very afraid in, want to prevent. And so it's about the dextrose water, cold dextrose water when we found the hotness or the suspected the laryngeal nerve injury. So how cold of the dextrose water, or how we prepare the cold water for this situation?
So usually if you really encounter nerve damage during the thermal operation, we recommend use 0 degrees Celsius. It means ice 5% glucose water to inject just peripheral in the nerve location. So for example, if we treat benign nodule, usually we will cause some thermal damage to recurrent laryngeal nerve. So we can inject the 5% glucose water, cold 5% glucose water in the thyroid bed. Or if you cannot inject into the thyroid bed, sometimes you can inject to the thyroid nodule directly to decrease the temperature of the nodule, because sometimes the heat will affect the adjacent recurrent laryngeal nerve and cause the thermal injury. So if you just prepare for a cold, you can put the 5% glucose water in the refrigerator. Once you need, you just use them. I think it's okay.
So that means every time when before the procedure, we have to prepare the ice, the cold dextrose water as well. Okay.
Not every time. I think if we prepare once, we really need. We don't have to be worried about. We don't have this kind of material. Just put the 5% glucose water in the refrigerator. Once we really need, just use them.
So what about the other speakers? Have you the experience for this?
Yes, and my only comment is that you need to inject the cold water for a very long time. The function takes about 15 to 20 minutes to come back. So you just keep injecting and you keep talking to the patient and pray their voice comes back. So this is it's very frightening the first time, I can assure you. But if you catch it early, the chances of them coming back is quite good. The other thing that we don't recognize is especially patients with big goiters. When they're lying down, everything is pressing on the trachea. So there's one patient that got a bit of voice hoarseness, but he was big. He was very big. So after a while, we got him back to about 90% of his original function. But the minute we set him up, once the weight gets lifted off the trachea, he was normal. So this is something to think about as well. But you just keep injecting until the voice comes back.
Okay.
I think it's not easy, because as I do recommend, you usually have to inject quite a long time, because the paper has mentioned usually during the injection, the patient will have their voice recover. But for my very limited experience, it really takes time. Even we inject the cold water, we just follow the paper which they told us, but it really takes time. Maybe 30 minutes later, it really takes time. You really very scary experience for us, I think, if you really.
And as a test of your patience as well. Yeah, so you better have a fellow injecting in the room, or else you're just holding the needle 30 minutes time.
Should some assistance, yeah.
Yes.
So are there any differences, between this still water and the normal saline? Some doctors recommend maybe this distilled water may.
So you don't really want, you can give distilled water, although distilled water is quite caustic to tissue. If you want, we give something physiological. If you intend to continue doing ablation, you should be using D5, RFA. But microwave is okay. Your microwave will boil whatever water. So if you still want to continue ablation after the patient lost their voice, you should use D5.
Okay.
So when you stop inject the cold water, so I mean, if the voice not recover, so do you have a time that, oh, this is too long to inject cold water anymore, then you give up?
Just usually the patient will recover, totally recover, but it takes time. If
Okay.
we inject cold waters in some situation, the patient really can recover maybe several minutes or 30 minutes, even 1 hour later. But if we don't inject, it takes time. For initially, I did not have this kind of concept. So my very scary experience was my patient recovered. Her voice about 4 months later.
Okay.
4 months later. The patient will recover because we just caused thermal injury. We did not resect. Just for surgery, because sometimes it's in very rare situation, the surgeon will resect the nerve. It's impossible for the patient to recover their voice. But even we just use the thermal, we just cause thermal injury to the nerve. It's will totally recover, but it really takes time, maybe several months.
Mm-hmm.
I do send them to the ENT. The injection is quite is an office procedure to inject into the vocal cords, and they get so much better. So I also think that we should not hold back from sending them to the ENT surgeon for injection. One of my classmates is doing voice, so she's my favorite person when I do thyroid ablation. But we should send.
Okay.
And I think Dr. Cheng, I think Dr. Cheng also showed the ultrasound of the vocal cords. I think that's quite neat as well. You can see it quite well. Surprisingly, you can see it quite well. You would think that it's the air structure, but like Dr. Sometimes you just, if they're moving, or you can see at the end of 30 minutes nothing is moving, you know you're in trouble.
Okay, so they have the question: is that the maximum amount of the water that we can inject?
Maximum amount, because I don't have much experience, but one time I discussed the question with my teacher, Professor Beck. Professor Beck just always told me, keep injecting until the patient recover their voice. But I don't have any idea about how much cold water we can inject for the patient, because some ENT doctor have worry about, because they think if we inject too much water will cause some compressive effect or mass effect for the patient. But if we inject to the potential space, it's okay, because this is kind of potential space. The fluid will goes to different place, maybe inside mediastinum or to other place. But I have no idea how much.
Commonly 20 to 70 milliliter stomach saline was used when I perform microwave ablation. I think patients is okay with the this volume of
because I do some literature, because for doctor using microwave, they usually perform hydrodissection even for the benign nodule, because microwave is very powerful. So they usually will use hydrodissection. So I remember some literature has mentioned even they inject more than 100 milliliter is also okay, but I think it's a little bit scary for us.
Yeah, sure.
Okay, so